Hi, I'm Christina, and I'm going to be doing the IV insertion. So first I'm going to check the doctor's orders. I'm going to check for allergies, the patient, verify the patient, it's the right patient. The doctor has ordered that blood will be given, so I'm going to be doing an 18 gauge. Right, so now I'm ready to prime my tubing. So first what I'm going to do is get my saline to prime my tubing. Open up the alcohol swab, swab the top of the tubing line. Alright, so now I'm going to open up my packaging for my IV insertion. The packaging was intact, the expiration date was not out of expiration. And I'm going to prime my tubing by entering the needle syringe. Tubing is primed. Tubing is primed. So now I'm ready to walk into the patient's room. Right, and I walk into the patient's room, I knock on the door, I ask them their name and their date of birth, ask them for allergies, let them know the doctor has ordered that they're given blood, they're going to get blood. So I'm going to give them an IV, an 18 gauge. And I'm going to ask the patient if they've had a mastectomy. She hasn't had a mastectomy on either side. Ask them where their predominant hand is. She's predominantly on the left hand, so I'm going to be giving the IV on the right side at the most distal part so that her activities are not limited. I'm going to wash my hands and I'm going to glove up. Alright. So I'm going to pick my site. I'm looking for a soft and bouncy vein. Something right here. So now I'm going to alcohol. And let the alcohol dry. I'm going to apply the tourniquet about 4 inches above the IV insertion site. To ask the patient to pump the vein, pump the fist, to check the radial pulse. Okay. Get my catheter ready. Alright, and bevel up at a 15-degree angle. I'm going to stabilize the vein and click pin. Alright, observe for flashback and half flashback. So I'm going to advance the catheter. Stabilize, drop the tourniquet. Connect the tubing. Open the clamp. And I'm going to go back to return. So I'm going to push stop. About 3 milliliters of saline. There's no resistance. so my placement is good. Now I'm going to apply my catheter. Going to take the remainder of the tubing. And I'm going to label the catheter. I'm going to put my the gauge size, my initials, and the date. And now I'm just going to document. And I'm going to document the time I did the IV, the date, the insertion site, so it's going to be the right lower arm, the number of attempts, which would be 1, and how well the patient tolerated it, the gauge size I used, which was 18, and any instructions given. I did tell the patient to let me know if the site became inflamed, uncomfortable, any pocketing of fluid or leaking, and that's it for the IV insertion.